Welcome back, everybody. Hope your Monday is off to a smooth start. You're watching Great Day St. Louis. Seems like it's a given these days. If you have a child, it's a good chance that somewhere along the line he or she is going to need braces at some point. But why spend years to straighten their teeth when you can actually do it in just a few months? This is pretty cool. It's actually possible with what's called Fastbraces. Dr. Anna Smith from Dentistry with TLC is here to explain the process, and her patient, very boldly, at 16 years old, Lauren Harris, is here to show us the beautiful results of Fastbraces. Good morning to both of you.
Good morning, Matt.
So, Dr. Smith, tell me a little bit about Fastbraces and how they differ from the traditional braces.
Well, Fastbraces are amazing technology that allows children and adults to straighten their teeth quicker, they cost less, they come with a lifetime guarantee, and there's no more sensitivity than regular braces. And so the difference in the technology is really that it allows us to do in 1 year what it takes traditional braces 2 years to do. So for example, Lauren's case, her mom was reminding me this morning that they actually had orthodontists tell them it would be probably 2 to 3 years to straighten her teeth and be in the range of $5,000 to $8,000. Well, with Fastbraces, we did it in less than 9 months. She has a great bite, straight teeth, and it was about a $4,500 case, so saved them thousands of dollars as well.
So literally, like, I guess a little more than half the price,
Right.
a little less than half the time that she was being, that her, her mom was talking to me before the show. Couldn't believe it. I mean, it seemed like a no-brainer. And Lauren, we've got some before and after pictures, and I want to ask you a little bit about the experience. Did you experience any pain? I know you've said you've had friends who've had traditional braces. Did you kind of swap stories?
Well, I mean, there was always pain after they were tightened and adjusted, but I really felt good the next couple days. I mean, my best friend got braces a month before me, and she got the regular kind, and she'll be in pain for weeks after, and also, she's still in them.
Now, oh, really? Poke, poke. Nicely done. Now, we're talking about what normally would be, again, a 2 to 3 year process, and you, by the way, the office is in Godfrey. You don't live anywhere close to Godfrey, do you?
Oh, no. I live in Ladue. So.
But your dad said, let's make the trip.
Yeah.
It sounds like it's worth it. Doctor, I just have to think logically that if you're moving the teeth twice as fast or even more rapidly than the traditional braces, that there's got to be an added element of pain, but it sounds like that's not the deal.
There's really not, and it doesn't mean that it has to be more sensitive just because it's faster.
Right.
If you look at her before and afters, one of the big things with Lauren was her bite, and she actually had a tooth that almost laid on its side, and we were able to upright it. That's a major movement with braces, and she had, as she can say, she had less sensitivity than what her friends are experiencing with their traditional braces. It's just in the technology. It doesn't have to be more painful to move a tooth faster. That's old-fashioned thinking.
Now, she's 16 years old. Are there good candidates and bad candidates for this kind of procedure? Is that about as young as you want to go, or does it really matter?
No, I've started kids that are about 10 or 11. That's usually whenever we start looking, because sometimes we can actually prevent children from needing braces if we start looking at them around age 7 or 8. So I would say about age 7 is when you want to start thinking about braces. Usually, if we do braces, starts around the age of 10 or so, and then I have 60-year-olds in braces, so it can be adults also.
But they won't be in them very long. And Lauren, you're happy with the results, I take it?
I'm very happy with
They look beautiful. This is where I'm not supposed to smile, because then everybody would see my giant gap next to these two beautiful sets of chompers right here. Thank you so much, Dr. Smith and Lauren, both for being here and sharing your story. We appreciate it. Dentistry with TLC has a great website. You can learn more about Fastbraces and Dr. Smith's full range of services, of course. Her office is located just 30 minutes from downtown St. Louis in Godfrey, Illinois, but people from Ladue are making the trip, I'm just saying. Call them, 618-466-0733 for an appointment, or visit them online at dentistrywithtlc.com. Thank you both so much.
Thank you, Matt.
You bet.
Come on.